The Health Department explains the spike in COVID recoveries that it released on Thursday. The Department of Health assures the public that it's following standards set by the WHO in its reporting of COVID-19 numbers. Greg Gregorio tells us more.
The DOH explains the spike isn't that unusual because the number is a product of data reconciliation and the reclassification of mild and asymptomatic cases. On Thursday, the Health Department reported the biggest single-day jump of around 38,000 recoveries, pushing the total count north of 65,000.
Marami pa rin sa reporting units natin, no? Especially yung nanggagaling sa ating local governments, hindi rin nila ina-update yung kanilang form for the outcomes of the patient.
Vergere explained that reporting units, including LGUs, had a different interpretation of the department's memorandum issued back in May and tagged recoveries longer than needed. Under the current protocol, asymptomatic patients and those with mild symptoms may be considered recovered patients once they've completed the 14-day quarantine without showing signs and symptoms of the disease, like fever. Vergere clarified, RT-PCR testing is no longer needed. What's more important is the capacity of the patient to infect others.
Even USCDC and WHO mentioned this. And pag nakita natin yung kanilang protocols for tagging recoveries na andun na, no, na talagang on the 10th day, talagang dinidischarge na nila, no, based on evidence na talagang you are non-infectious.
The Health Department admits it's struggling to attract additional healthcare workers. On Thursday's episode of One Says the Chiefs, Vergere says they're considering giving incentives so more professionals will apply.
Kailangan lang talaga i-incentivize na mas maayos at maipaliwanag talaga na talagang pangangalagaan sila ng gobyerno.
The likes of Perlin Bon heeded the call. For managing their family business, she decided to practice nursing when COVID infection hit thousands of Filipinos.
Pag nangihina na ako, kapag sobrang pagod na ako, kinakanta ko na lang yung aking adhika, makita ka sa kalan. Kasi talagang nakakapanghina yung situation natin ngayon.
She's now with the National Kidney and Transplant Institute, which says that they would need hundreds of new hires if they were to allocate more beds for their COVID care.
Expansion is about capability to provide health care. That means you have to have the people.
The NKTI has allotted 45% of its beds just for COVID-19, and they're now close to full capacity. Gregorio, we are One News.